Good afternoon, everyone. Welcome to the informational webinar on enhancing and accelerating outbreak response and prevention in healthcare settings, virtual workshop for health departments. Today, I will be going over information pertaining to this workshop, and I will be providing an opportunity for some Q&A at the end. And so as I progress through this workshop, please ensure to use your question and answers box to add your questions as they come up, and we will do our best to address them at the end of this webinar. This event is being recorded. The slides and recording will be available after the event on our events page website at this URL. Please mute your microphone and video during this presentation to avoid any distractions. Before we dig into today's content, I want to pause and acknowledge that we live and operate on unceded land of Indigenous people throughout the United States. At the Population Health Innovation Lab, we recognize that land acknowledgements are an important step towards honoring the Indigenous peoples who have been stewarding U.S. lands since time immemorial, but they're just a starting point. We invite you to learn about the tribal nations and Native communities in your area through research, relationship building, and partnership with tribes and tribal organizations. I am located in Chicago, Illinois, which is the ancestral lands of many Indigenous nations, including the Anishinaabe, or the Council of the Three Fires, which is made up of the Ojibwe, Odawa, and Potawatomi nations. Learn more about land acknowledgements and how you can move from acknowledgement to action from www.nativegov.org. And so for today's agenda, we will be introducing you to the Population Health Innovation Lab, or PHIL for short, letting you know who we are, introducing you to the PHIL Collective, one of our collection offerings. And then we will go through the workshop overview, the daily agendas for this 3-day virtual workshop, the learning outcomes, and introducing who the lead trainers will be, as well as providing registration information for you all. And as I said on previous slides, we will be spending about 10 to 15 minutes for a questions and answering session. And so now I'd just like to provide you with a brief introduction to the Population Health Innovation Lab. We go by PHIL. We are a program of the Public Health Institute, or PHI for short. At the PHIL team, we provide innovative training, research, and technical assistance that is designed to catalyze and accelerate community efforts aimed at enhancing equity, well-being, and systems through cross-boundary collaboration. The PHIL Collective is just one component of the many offerings that the PHIL team has. Our PHIL Collective provides communities and collaboratives working across sectors with support, insights, and skill-building opportunities to more effectively address complex health challenges and change systems. You'll see on your screen right now, I have a few bullets of current offerings, which include web discussions where we bring together different practitioners to engage in interactive sessions with experts and peers on cross-sector collaboration topics. We currently provide action-oriented workshops, allowing participants to participate in hands-on workshops to develop actionable strategies for community initiatives. And lastly, we are currently offering a learning lab experience, which will offer individuals the opportunity to collaborate over extended periods of time to tackle shared challenges and innovate around common goals. Again, these are just our current offerings, and so they're offerings that we are starting with. Our offerings are always evolving, and so I really recommend that you sign up for our PHIL Collective updates and be the first to know what is coming up in the PHIL Collective next. And so one of our collective offerings is called the Foundation Forward Collection. And what exactly is this? This collection is a conglomerate of offerings crafted by the PHIL team to enhance local health departments' foundational capabilities in alignment with the Public Health Accreditation Board framework, as outlined in the Foundation of Public Health Services, or FPHS framework for short. This collection will be offering various trainings across increasing LHD capacity to be able to deliver their 5 foundational services across communicable disease control, chronic disease and injury prevention, environmental public health, maternal, child, and family health, and then access to and linkage with clinical care. These trainings will be centered at improving the capabilities below highlighted in the blue boxes: assessment and surveillance, community partnership development, equity, organizational competencies, policy development and support, accountability and performance management, emergency preparedness and response, and last but not least, communications. These collection of trainings, if you'll note, are also in alignment with an outcome area of the Public Health Infrastructure Grant. We recognize that many local health departments who are direct or indirect recipients of Public Health Infrastructure Grant, or FIG for short, are tasked with improving their foundational capabilities across these 8 areas. And so health departments are able to utilize their FIG funding to build the capacity and expertise for the health department across these areas in this foundation forward collection. And so just to give a bit of a background before I jump into the 3-day virtual workshop objectives, the Phil team recently completed a project with the National Association of County and City Health Officials, or NACHO for short, as some of you are familiar with. In this project, our team led a 1-year assessment where we did qualitative interviews with health departments across the country to identify their awareness, access, and use of various kinds of infection and equity data to conduct outbreak response work in healthcare settings. Following that project, we worked with the NACHO team to develop different resource guides to increase the capacity of health departments doing this work. One of the guides are the Data Utilization and Management Guide, which provides strategies, tools, and success stories from other health departments for effective data utilization and management skills. The second is the Equity Framework Guide, where we provide health departments with different strategies and tools to operationalize equity in their outbreak response work in healthcare settings. And then lastly, the third guide was the Strategic Collaboration Guide, where this guide is equipping health departments with strategies for effective collaboration strategies and partnership strategies with their healthcare partners and other key partners for conducting their IPC work in healthcare facilities. At the end of this project, we held a couple of in-person workshops to train other health departments in operationalizing these guides. And we also held a series of webinars that are now up on the NACHO website as well. And so to jump specifically into the 3-day virtual workshop, I wanted to give an overview in terms of objectives, formats, and what the focus areas are. Again, the objective of this 3-day virtual workshop is to equip your health department with tools and strategies to strengthen your outbreak response and prevention work in healthcare settings. This will be a 3-day virtual workshop with interactive sessions, activities, and reviewing some shared case studies. Each day will support 4 hours of learning, and of course, we have some breaks integrated into each learning day. The focus area of each day will be health equity, data utilization and management, and then lastly, strategic collaboration. This workshop is ideal for public health professionals at health departments who play a role in their health department's HAI program, Healthcare Associated Infection Program, their different outbreak response teams, and if you're just someone at a health department who supports your health department's efforts in outbreak response and prevention with your healthcare facility partners. Objectives of the workshop. Objective number 1 will be to support health departments in integrating health equity. Health departments will learn and apply an equity framework tailored to outbreak response in healthcare settings and learn how to promote inclusive and effective targeted interventions with their healthcare facility partners. Objective number 2 will be enhanced data management for outbreak prevention and response. In this workshop, you will learn and develop your skills for different data collection, analysis, and application to be able to more streamlined and easily track all the different data that you have available for preventing and responding to outbreaks. Lastly, objective 3 will be fostering strategic collaboration for outbreak response and prevention. We will dive through different activities to strengthen your ability and your health department's ability to strengthen your partnerships and optimize outbreak prevention and response efforts. And so just wanted to go through briefly what each day of the workshop will look like. Again, each day is about 4 hours long. On day 1, we will focus on equity. We will introduce health equity and outbreak response, what the concept of unequal transmission looks like. We'll provide you an overview of the equity framework that we developed with the NACHO team, as I mentioned earlier in this presentation. And then we'll go through applying different techniques such as using social vulnerability index, CMS care compare metrics for different targeted outbreak interventions. We'll go through different use cases. We'll demo different tools like Tableau dashboards, provide you with some templates that you can apply in your health department. And we'll have some activities to support you in developing interventions that are based on different equity indicators and to discuss various targeted approaches for the diverse needs of your community. Day 2, this will focus on data utilization and management. Again, for the data utilization and management guide, one big piece of this were success stories from other health departments and the work that they do. We will go through some of these success stories together through different interactive exercises. We will explore different kinds of public websites to obtain facility level and community level data collection for your outbreak response work, such as CMS Care Compare. We'll investigate different ways, such as different data downloads, connecting APIs so that you can have more streamlined data processes. And we will draft a plan to implement data management strategies for outbreaks in your health department as well. Lastly, day 3 will be on strategic collaboration. We will focus on building and sustaining partnerships for outbreak response. We'll do different activities such as using Kumu, which is a asset mapping and network mapping software in order to visualize your partner networks. We'll explore different case studies and analyze various partnership strategies for effective outbreak management. And then we will work with you to identify potential partners and outline collaboration plans for your future outbreak response and prevention. And so essentially by the end of this virtual workshop, participants will learn how to have implemented a health equity framework. They will know how to strengthen their data management and utilization processes. And lastly, they will establish and strengthen their strategic partnerships and gaining tools to develop and sustain collaborations that enhance outbreak response and prevention efforts in healthcare environments. And I just wanted to take a minute now to just introduce who the lead trainers for this virtual workshop will be. I will be one of the lead trainers. A little background about myself. I've worked as an epidemiologist. I'm supporting the Public Health Institute's California Contact Tracing Support Initiative during the COVID pandemic. I've also previously worked with the state of California Department of Public Health as a health informaticist focused on surveillance activities for different bacterial and viral STIs. Stephanie is the director of the Monitoring, Evaluation, Research, and Learning Innovations branch of the PHIL team. She will serve as the principal investigator. She serves as the principal investigator and directs the scientific vision and strategy for PHIL. Stephanie was also previously an assessment epidemiologist and has extensive experience in this area. Now, last but not least, Cassandra Mohan is a research associate here at the PHIL team. She has worked in infectious disease epidemiology with New York State Department of Health and with the CDC in the past. Cassandra also has a passion for outbreak response and prevention and has a lot of expertise in data visualization and innovative public health solutions when it comes to infection prevention control work. And so lastly, just want to share with you all upcoming workshop dates and registration. If you've recently visited our website, you will see that registration is closed for the November 19 to 21 date. However, registration is still open for December 11th to 13th workshop dates, and also for the January 22nd to 24th, 2025 date. We have some early bird registration discounts as evidence on your screen right now. Early bird registration fees are $775 for the virtual workshop. Regular cost is $850. And we also have a 20% discount for individuals from an LHD where 3 or more individuals register for this virtual workshop. Also, if you're joining us as an individual who previously attended the webinars that we hosted with the NACCHO team, you will also receive a 10% discount promo code for registering for this virtual workshop. And again, please use the QR code on my screen right now to visit our registration page for more details. One question that I have received recently was, how health departments might be funding this opportunity. And one thing that I've been letting people know in the past is that this training fits directly under the assessment and surveillance capability for the FAB Foundational Public Health Services Framework. Health departments who are direct recipients of FIG are eligible to utilize funding for trainings to improve their foundational capabilities in this area. I recommend outreaching their workforce development officers or their appropriate health department personnel to request how your health department can process a TA request to participate in this virtual workshop. And with that, I will hand it over to the Q&A moderators for questions that may have been added during that presentation.
All right, we are going to let some questions trickle in for just a minute. Attendees, if you have any questions, please feel free to hit the Q&A button down below and type in your question, and we will do our very best to answer them. All right, I'm just going to give it another couple seconds for some questions to come through. We did pull a couple questions from the registration, so if you see a couple there, we've already included them. All right. And Sean, I will ask you the first question. Can LHDs use FIG funding to pay for the training? You kind of mentioned this, but
Yeah, like I said previously, this training is targeted at improving health department foundational capabilities under the assessment and surveillance capability under FPHS. Direct and indirect recipients of FIG funding, I recommend reaching out to their workforce development director or the appropriate position in your health department to inquire more how you might be able to tap into getting this covered under FIG at your health department.
great. Thank you so much. And sort of a follow-up question to that, is there a limit on how many members from a health department can register to attend, or is there no limit?
There is no limit on the number of members from a health department can attend. If you see that there is benefit from your entire HEI program attending this training together, by all means, please all register. I see benefit in having, your data analyst, your epidemiologist, your infection prevention nurse all taking this training together. I think that'll lead to a more cohesive workforce in terms of your HEI program, and we definitely recommend that if that is applicable to your health department.
Great. Thank you so much, Sean. Okay, next question for you. How does the workshop approach data management for outbreak scenarios, and what types of data skills will participants develop?
It's a great question. As I stated earlier, some of the tools that we'll be using during this virtual workshop are the guides that our team has developed in partnership with the NACHO team. For data management for outbreak scenarios, we will be pulling specifically from the data utilization and management guide, where we have shared a plethora of success stories of different practices by other health departments. This includes things like REDCap templates, different frameworks in how they are measuring the effectiveness and impact of their outbreak response strategies. We'll share different success stories and guidelines on different types of data to collect for your outbreak response work. Again, with the whole goal of ensuring that virtual workshop participants leave this virtual workshop with a plan that is actionable for them to implement in their county, knowing exactly what websites for publicly available data on their nursing homes and long-term care facilities they can pull information from, and being equipped and able to learn to develop different processes to collaborate with their healthcare facilities for data that may not be readily available to them online, so that they can develop a holistic view of their healthcare facilities that they conduct outbreak response work in.
Great, thank you. All right, and just as a reminder, folks, please feel free to put in questions in the Q&A function below. We will move on to our next question. Are there any follow-up resources or support offered to participants after the workshop to reinforce learning?
Yeah, that is a great question. We want nothing more than ensuring that participants leave this workshop feeling empowered to be able to increase their outbreak response expertise and competency. To support this, not only in delivering the workshop, we will be maintaining and sharing an online resource hub for all workshop participants so that they can access the different templates, the different tools, the different recordings that were developed during the workshop. And I think one thing that we've really realized is very important in the in-person workshop we delivered last month is we will be connecting all health department participants with other health departments. In the in-person workshop, we noticed how great of a space it was for one health department from Florida and Washington and New York and Texas to be problem solving for similar problems in their jurisdiction together. And so something that I think is great that will be an outcome of this is the peer connection with other health departments to continue that collaboration on this work.
Great. Yeah, that peer connection seems to be a really important point and something that LHDs really need in their important work. So thank you so much, Sean. We'll move on to the next question I have for you. There's a couple more left. Will any case studies or real world examples be shared during the workshops?
Yes. We will share many case studies between the data utilization day and the health equity day. Specifically on the health equity day, we will share real world scenarios from the literature on how different equity frameworks were operationalized in different settings. We will share real world scenarios in how different health departments have operationalized an equity framework for the outbreak response work. And then we will also have some use cases that we've developed, showing the different ways to operationalize equity in outbreak response and also in outbreak prevention. And so in instances of like responding to an outbreak or actively working to prevent it because of upcoming flu season. Secondly, for the data utilization and management day, we will be sharing a plethora of real world examples for how different health departments around the US have implemented various data utilization strategies that your health department could take some inspiration from.
Great, absolutely. And I know we have a few attendees who attended the NACHO webinar on this call. And I think if you enjoyed those NACHO webinars, I think you'll really be able to dig deeper into these workshops. So thank you, Sean. Okay, this is our last question at the moment. Again, if you have any other lingering questions, please feel free to put them in the chat and we can answer them. Last question for you. How many members from a health department can register to attend? You sort of already hinted to that. And is there a discount if more members attend? Can we pay using a PO?
I'm going to go back to a slide previously. As many members from your health department can attend who are part of your HAI program or carry a role in conducting outbreak response and prevention work in your healthcare facilities. Again, we will have a 20% discount for groups of 3 or more individuals from a health department. I cannot say I fully understand the acronym PO here. And so if you want to add to that question, please do so.
Yes, that would be helpful. I was wondering the same thing. So I'm not sure if anyone on this call wants to, oh, okay, purchase order. If you're familiar with the purchase order.
Purchase order. I am not familiar with a purchase order, unfortunately.
Yes, so that's something that we can definitely look into. Sorry on that end of things. I will double check on Eventbrite for that. But if you are the one who is interested in purchasing via purchase order, if you wouldn't mind just sending that to info@pophealthinnovationlab.com, we would be more than happy to field that and look into further possibilities.
Yes, we'll put the email in the chat as well. Yeah, perfect. It's on this slide. So we're more than happy to discuss that with you via email. With that, I think that is all of our questions for today. Thank you so much, Sean, for answering all of these questions. And if you want to wrap us up, we can end this webinar.
Yep. Thank you all for joining us on this informational webinar today. We hope that we were able to provide you all with the additional information needed to make a decision on whether your health department joins this webinar. We believe that in participating in this webinar, you will leave with very actionable and implementable and very feasible steps in improving your health department's approach in operationalizing equity for your outbreak response and prevention work, and improving and streamlining the efforts for your data utilization and management practices, and also building and improving the partnerships that you have with your healthcare partners. I hope you all have a good day, and I look forward to seeing you all at one of our upcoming workshops.